It is very likely that flu viruses and the COVID-19 virus will both spread this fall and winter. Influenza or the flu and COVID-19 are both contagious respiratory illnesses, but they are caused by different viruses. COVID-19 is caused by infection with the new coronavirus, and the flu is caused by infection with any number of influenza viruses. Today we will look at the differences between flu and COVID-19 so you can best plan for preventative measures in your workplace when we come right back.
Welcome to this episode of Workplace Health, Improving Employee Health and Productivity, with President of Workplace Health, Inc., Shauna Dunbar.
As you may know, COVID-19 is a new virus we have not seen in circulation before. So there is still a lot of research being collected about how this virus spreads and replicates. We do know, however, that those infected with COVID-19 and the flu can have a variety of similar signs and symptoms. Some include fever or feeling feverish, having chills, a cough, shortness of breath, or difficulty breathing. You have extreme fatigue with muscle pain or body aches, headache, and even sore throat. Thankfully, most people will have a mild case of flu or COVID-19. When complications do arise, though, COVID-19 seems to cause a more serious illness in some people, according to the CDC. And of course, we still do not have many FDA-approved treatments for COVID, while there are antivirals to treat influenza. It typically takes a day or two for a person infected with the flu to start feeling ill. It takes coronavirus symptoms longer to appear. COVID-19 symptoms appear 2 to as many as 14 days, or an average of 5, after being infected. For both COVID-19 and the flu, it is possible to spread the virus at least 1 day before experiencing any symptoms. And as we know, some people can be infected with either COVID-19 or the flu and be asymptomatic, meaning they do not show any symptoms at all. These folks can still spread the disease just like someone who is ill through respiratory droplets when they cough, sneeze, or talk. These droplets can land in the mouths or noses of nearby people and can possibly be inhaled into the lungs. So both COVID-19 and the flu can result in complications such as pneumonia, respiratory failure, and sepsis, which leads to hospitalization. So your best defense against flu is vaccination. There are multiple FDA-licensed influenza vaccines produced each year to protect against anticipated flu viruses. Currently, there is no vaccine to prevent COVID-19, though multiple drug makers are in the process of creating one. So protect the health of your workers this flu season. It is likely that flu viruses and the COVID-19 virus will both spread this fall and winter. Healthcare systems could be overwhelmed treating both patients with flu and patients with COVID-19. This means getting a flu vaccine this season is even more important than ever. While getting a flu vaccine will not protect COVID-19, they have been shown to reduce the risk of flu illness, hospitalization, and death. Getting a flu vaccine can also save healthcare resources for the care of patients with COVID-19. So please contact us for a summary of this content and to schedule a flu clinic at your workplace. Now go make it a great day.
Thank you for watching Workplace Health. For more great information, visit www.workplacehealthinc.com.